We are very pleased to be presenting this webinar. It's really one of those the people have asked sort of things, and it's been a long time coming because our presenter is such a busy guy. It's hard to find a time when we can make it work, but here we are. I'm going to give a very brief overview of BGU, Ben-Gurion University, of the Overseas Student Program. For the folks who are more familiar, maybe it'll be a little bit nostalgic, especially if you've had the chance to visit. And for the folks that are new, it's a little bit of context so that you know where this fits in. So I'll speak very briefly because the main event is Professor Davidovitch, and we want to give him the main stage and have time for questions. Okay, so thanks everybody for making time. Okay, so those of you who know something about us know that we're based in Sheva, which is about an hour south of Tel Aviv, really in the center of the country, the gateway to the beautiful Negev desert. And for 6 years running, we've been voted the most popular school in Israel based on academics and on the campus experience. We are not a commuter school. People really move down to the Negev and live there and build their lives, and it's really very similar to an American university in that way. Every possible activity you can think of, really fantastic academic experience, and we're growing. I mean, when I started this position less than 6 years ago, we were 16,000 students, and now we're up to 20,000 students. The Overseas Student Program is the undergraduate study abroad program that's sponsored by Ben-Gurion University. We're in our 26th year. People have the opportunity to study for a semester or a year. We offer intensive Hebrew language and Arabic ulpan, if you're familiar with that immersion language where you study, where you're actually doing 5 or 6 hours a day for 5 days a week, so that even somebody who doesn't know the language over the course of a month can really become able to communicate very nicely. And because Beersheba is a place where there are fewer North Americans, and it's a very diverse city with people from every background, Hebrew is the language of discourse, so people really absorb it and use it. The courses in the overseas program are offered in English, although if there were a student who had advanced Hebrew, they could take every course in the university is open to them. But we offer about 25 courses each semester in English in a variety of disciplines. And when we end, I'll send you to our website and you can learn more. But we have specialized track areas that offer our areas of expertise: global health, which is why you're here today, sustainable development, and Israel studies. These are the things we're really very well known for, certainly in the international academic community. And we offer volunteer opportunities and internships for credit. The internships are actually mentored research internships where they're really working on projects with our researchers. I've talked a little bit about Beersheba. It's really very diverse. What's nice about it, it's kind of old school Israel, meaning Israel is very cutting edge and very sophisticated, as is Beersheba. But it's also sort of old school Middle East. You know, people aren't in such a hurry. They sit you down. They want you to have a cup of coffee. You get to know the vendors in the marketplace. And international students who come to Beersheba really become like the locals. They're living, by the way, on the OSP. They're living with Israeli roommates, which is part one of the immersion. And when they go out to do their shopping and they use their Hebrew, people will answer them in Hebrew. In other words, you know, nobody is trying to be extremely westernized there. You can get by in English. But really the beauty of the program and the city and the university is that you're really in Israel. You're really in the Middle East. You're not in a westernized place that's trying to be something that it isn't. On the other hand, in 50 minutes, you can be in Tel Aviv, have dinner, and turn around and come back. There's a train station right on campus. A few pics to show you the campus. BGU is celebrating its 42nd anniversary. It's the youngest of the Israeli universities, which makes it interesting. In other words, we all know how it is to work in institutions and bureaucracies and how things are sort of set in stone. And BGU is a pretty flexible and exciting place, and I think a lot of faculty, and Nadav is an example of that, travel from all over the country to teach at BGU. He's based in Tel Aviv, but he gets on the train or he gets in his car. People want to work there. Students want to come here, and faculty want to teach here. It's a fabulous place. And the students as well are very interested in international students, the Israeli students. So again, if you have you see who can apply. We also often have, if you come across them, graduating seniors who are looking to do something for a semester or a year, or they may be looking to fill some equivalencies for a graduate degree. We also have graduate students in the OSP. I'll mention that we have several graduate programs in English. That's not our agenda here, but if people are interested, I can give you that background as well. And again, I'm not going to read the slide, but you get the idea that that students who come on the program are offered a very rich extracurricular opportunity to see and learn the country besides the South. So there are several trips and tours that we organize that are included in the program. And we have terrific counselors who will help students plan their own weekend trips. The nice thing about Beersheba is, yes, it's in the South, and it's the gateway to the desert, but actually, if you look on a map, it's in the center of the country. So if you're going to do weekend trips or holiday vacation trips, you're situated in a fantastic place. You can get north, and you can get to the very, very south, and you're right in the center of the country, and of course, the train is very accessible. This I mentioned, the dormitories are right outside the gate of the university, and there's another gate and security check to get them into the dormitories, but it's a very quick walk. And the dormitories are apartments with usually 2 or 3 single bedrooms. On occasion, there'll be a double bedroom, and then the suite mates will share a living room and a kitchen. And it's always been our policy that in a particular apartment there will be one or two international students and 1 or 2 Israeli students. And the American students will not be with another American. In other words, they may be with somebody from Brazil and an Israeli or 2. So there may be another international student, but it won't be another American student. And everything they need is right there in the complex. There's no meal plan on campus. That's the case in all the Israeli universities. It's not like an American university in that way. But there are very inexpensive options for meals and eating. So whether you want to, go to the market and cook, or whether you want to buy a falafel, you won't starve. Your students won't starve. Mr. Ginsberg and Mr. Ingerman are our sponsors. They offer very, very generous scholarships, and I'll be happy to tell people more about that if there are questions about it. We are doing something new this year, which was we're offering a travel grant. We're going to give out 2 travel grants of $2,500 each for a student who wants to do or continue actually a research project that they've been working on in the States, or that's something that they want to develop in their time in Israel. Okay, so that's all available on our website, and I did want to highlight it today. And now I can stop talking. You don't have to listen to me because we're about to present the main attraction today, Dr. Nadav Davidovitch, who is on the faculty at BGU. He's also an MD, a public health physician, who's a very prolific writer, and some of your faculty members will know his work. He's the chair of the Center for Health Policy Research, the head of the Middle East chapter of the European Public Health Association, and his areas of interest, as you see here, are really dealing with public health, global health. He's a real expert. We're very lucky to have him and to have somebody of his stature who's so passionate about working with undergrads and with international undergrads. That's really what's very unique about BGU, is that people have access to people like Nadav. I really have loved working with him the past few years. It's really been a lot of fun, and I'm so proud and happy to have a chance to introduce him, to stop talking, and to have him tell you about our track in global health. Nadav, it's up to you, and I'm going to get out of the way.
Hi, can you all hear me? Okay, so thank you so much, Andy, for the generous introduction. A few words about myself. I'm a public health physician. I did a PhD in sociology of health. And now my main field of interest are related to health inequities, both in Israel, but also related to global issues, health and immigration, vaccination policy. I'm very proud to say that next week we're going to have our annual conference. Each year is devoted to reducing health inequities here in the Negev. The way we're doing it is that we are constructing several working groups that are working for about half a year on different topics. And next week we are going to present to the Ministry of Health, to the Ministry of Finance, and other important key holders about what we were doing, and it will be adopted by the probably by the Ministry of Health, issues like establishing a new hospital in Israel. Okay, so several years ago I was asked by our overseas program to establish a global health track. We have in Ben-Gurion University already an international MD program that I'm teaching there. And since anyway we have many faculty members doing research related to global health, either in infectious diseases, vaccination policy, but also environmental health, mental health, we thought that this would be an amazing opportunity. We have already several connections working with universities such as Columbia School of Public Health, Drexel University, UCLA, University of Illinois Chicago. We have National Science Foundation projects, and we have also a very tight connection to several organizations working in Israel and in the Negev, both related to the Ministry of Health and related to sick funds and NGOs. So we thought that the opportunity to have also a practicum related to the Global Health Track would be a nice opportunity. So during the last years, we suggested practicum opportunities related to clinic in a Bedouin town. The Bedouin population is going through a major transition right now with unfortunately rising rates of diabetes, relatively higher rates of infant mortality rates. And we have several organizations like Physicians for Human Rights, but also the Clalit Health Services and others that we are doing together several projects. And what was great that we could introduce students arriving to do the Global Health Track and work together to actually implement what they were studying in class in several projects. Several students that were working with me and other faculty members were later accepted to medical school, to programs of public health, so we're very proud of them and continue to be in touch. We have a Soroka Medical Center. It is an 1,100 beds hospital. We are working very closely on several research projects, but also health promotion projects. We developed a community garden together. This was a project 2 years ago with some of the students arriving. We're working very closely to an STD clinic in Tel Aviv, and we had several tours there and students working. This is an STD clinic that is free and also could accommodate quite easily students working with asylum seekers, with migrant workers, drug users, and working together actually with the outreach part of the clinic, and this was an amazing option as well. I myself on the board of Physicians for Human Rights. They are operating an open clinic for migrant workers and refugees in Tel Aviv area. They also have a mobile clinic, and this was another option. We just published a paper together with our former student on 1,500 cases of asylum seekers that went through Sinai, and analyzed the interviews that were conducted together with an Eritrean nurse. And again, it was an amazing contribution of the students that later we could publish also their results. So we have the Global Health track that include a required course on health in the age of globalization. This is where we set all the basic kind of terms, discussions. And then we have also other more focused courses such as eco-health, a very successful course that integrating issues such as climate change, ecology and health, issues like air pollution, but also how positive effects can be of the environment, such as city planning, transportation, and health. And usually in the eco-health course, we're also doing a case study of conducting a health impact assessment tool adopted by the World Health Organization. Another course is about cultural psychiatry, dealing with issues such as health and migration, collective trauma. We're working together with several social workers, both in Soroka Medical Center and also some psychiatrists, and dealing with different groups within Israeli society, such as Jewish immigrants, non-Jewish immigrants, other stress-related problems, issues of poverty and health. And again, we have also field trips. We have the psychiatric hospital in Beersheba that we have a very good collaboration. And lastly, we have also a course that is dealing with infectious diseases that Professor Inon Shenkar, that was working for many years in the WHO, developed, the diseases that change the world. He is conducting already for many years visits also to Ethiopia, HIV-related projects, STDs, vaccination policies, and also the idea is to have case studies being discussed in class. What is really great about a previous experience that many of the students, after they get to know in their practicum some NGOs, some of them also remain for a longer time to do maybe an internship, volunteering. Some of them remain to do an internship and have research opportunities. As I mentioned, several articles in peer-reviewed journals were published, and I think this is an amazing opportunity. And I'm very proud that some of the students later on went to and were actually integrated in medical schools, schools of public health, and doing their graduate degree, and I'm keeping in touch with them. Some of them returned the year later to continue and help with some of our projects. So I think that now I go back to Andy that will discuss the issues of applications, deadlines, and of course I will remain for the questions. So Andy, the floor is yours.
Okay, Nadav, thank you. Nadav gave us just an overview, obviously, because we wanted to really to be able to address your questions. Just a word in terms of the application deadlines. What you see on the screen are our deadlines, and if somebody spontaneously decides that they'd like to come and it's past the deadline, we generally don't turn them down if they're an appropriate student. So these are the deadlines, but be prepared to, we're happy and prepared to work with you if you have somebody past the deadline. Okay, I'm very nervous. Can you tell? I feel like I'm on TV. Okay, this is where we really want to hear from you. We would like to hear some of the questions that I actually have a few that have come in, and I'm going to give them to Nadav to answer. Nadav, maybe you want to hit broadcast so that you're back on the screen. I think we can both be on here together. Okay, so one of the things that came in earlier I think people are interested in general in learning a little bit more, have a little bit more detail about the practicum. In other words, a little bit, what's the day like? How does it work in terms of a schedule? When and how do they go? Is it one full day a week? Is it parts of days? How does that work?
So usually during...
Nadav, I'm going to ask you, you have to speak up. We can barely hear you.
Can you hear me better right now?
Good, yes.
Okay, so during the beginning of the course we had some field trips to the places where later on we'll have the practicum, so people can get to know the places, so there is some choice, and we try to have this combination where some people maybe are more interested in health and immigration, so they maybe can located at the open clinic. Maybe some people are more interested in the Bedouin community, or maybe some people are interested in diabetes and so forth. Then during the semester, it is usually 1 day per week. The supervision is actually by affiliated people that are affiliated to Ben-Gurion University, that they have a usually clinical position, and also we have a coordinator, a research assistant that actually, or teaching assistant that is also working very closely with the students, and of course also me, to see that people are really gaining the most from their experience. Throughout the semester we also have feedback, but I must tell you that students were elated to be in those places. I think in Israel, in terms of our culture, people in the Ministry of Health or sick funds or NGOs are very, very open to have students from abroad, and especially if students are very motivated and they're willing to help maybe collect some data and work on a position paper. And usually this is the case, so it's really up to them, and if they, as much as they want to be involved, they can go ahead and do it. And I must say that although I was stressing maybe research papers, we had also students that were helping in structuring questionnaires, in helping writing position papers that were later presented in the parliament. We had the case of bisphenol A that you probably know also in the United States. It's a big problem. And amazing students from UAC that was helping us to write the paper, doing the comparative analysis about policies in other countries. So the students are really, really engaged in real work, and it's something that is very practical and related to policy or research, and we are very in close contact with the students. It's once a week, the whole day, and supervised and working together with people that are affiliated to Ben-Gurion University.
Okay, great. And the practicum is optional. In other words, you have to be in the track in order to do it, but if you're in the track, it's optional to do the practicum, correct?
Right. What is required in order to be in the track is taking the Health in the Age of Globalization course, and then having the practicum. Of course, you can just have the course and not being in the track, but usually people that are in the course are also doing the practicum. We also connect the practicum to the Health in the Age of Globalization course, so it's really a perfect match of having both the theory and practice, and not to something that is disconnected.
Okay, I see two interrelated questions here. Do I have to be working on a health-related BA in order to be in the practicum? And if I don't have any of this at all, can I, not the practicum, but the track? In other words, is the track open to people other than health studies majors? And if so, if I have no background whatsoever, will I be okay in the track? If I'm just doing something very different than what I usually do for my academic work?
Right. So, of course, if you are in a health-related track, I guess it would be kind of more natural, but we had in the past amazing students arriving from different tracks. I am definitely those coming from social sciences and maybe interested more in globalization, so they can see how health is integrated in this topic. Maybe students that arrives from anthropology, maybe those who are from environmental studies, and actually or public policy, economics, psychology. So since we're talking here about global health and health policy, we can actually adapt to the special needs and also special interests of specific students. So maybe some students will be working much more with qualitative methods, maybe some of them with more quantitative. But as public health, as I perceive it, is interdisciplinary. So this is even a nice way to do this conversation in class, how you can integrate different perspectives and disciplines, because this is public health. You have people coming from quantitative and people coming from qualitative. We have ethical discussions. And for me, this is just a lesson how people from different disciplines can be integrated. So yes, definitely people can are, but of course they need to have the interest. Otherwise, I guess they won't be going there anyway. But it's not a requirement.
Right. To echo what you said, we did a webinar last semester with Professor Alon Tal, who I know you know, about the sustainability track, and he talked a lot about the global health studies and the global health track and the overlap in the topics and how, as we know, everything is related to everything. So for folks who are listening, even if you have students who are in other disciplines and other majors, they could be encouraged to look at how this might be appropriate for them and really enrich their academic course of study. Okay. Somebody's asking if there are opportunities for visiting professors to teach courses at Ben-Gurion and vice versa. I don't know if we can actually answer that here because it's a bigger global question about BGU, but I would be happy if the person, Aaron asked the question. If you want to contact me afterward, I would be happy to find out about that for you. Unless, Nadav, you have something to say about that. I know that you're working right now on a program with another university and how your team teaching, and maybe that'll help answer part of the question.
Right. So
Nadav?
First of all, just to mention that Alon Tal...
We cannot hear you. Nadav, we cannot hear you.
Can you hear me?
Yet now, yes.
Okay, so just briefly saying that Alon Tal is an excellent friend. We were advising several students together. He has a PhD in public health, so it's not a coincidence. And I'm teaching a course on eco-health at Arava Institute that Alon Tal was one of the founding fathers. So definitely sustainability and public health, global health are very much related. To the question of opportunities for visiting professors, so specifically at the Faculty of Health Sciences, we have what is called the DOZO visiting professor that people can apply, especially if there is a project going on together. I should say that we have now this July summer course in global health for graduate students, and this is also together with Drexel School of Public Health and Professor Michael Udell, who is a public health ethicist. He'll be going here to Israel with some of his students and be part of the teachers, and we have together a project on autism policies, a comparison between Israel and the US, and we're also advising together an MD PhD, an Israeli MD PhD from Ben-Gurion University that is spending some time now at Drexel. They opened a research institute on autism. So I think it's pretty much also based on individual interests, and I think that there always can be options to do some research together, maybe applying for the National Science Foundation. It's a grant for Israelis and US-based professors. So this was the case with Professor Michael Udell and other cases.
So I will just add to that there are opportunities for those of you who have faculty members that are interested in finding some way to work together with us. There are opportunities for building, some kind of version of a faculty-led program. I mean, we have Nadav, and he runs the show, but he's a collaborator. So there, if you have someone who's sorry, I lost connection there for a second. You again, be in touch with me afterward, and we can talk about that more specifically. And Nadav also hinted at a short-term program. We have some short-term programs in the works that perhaps will be happening in the coming summers in global health, and we'll keep you posted on that. We know that some students prefer a shorter term than a semester, but we're very excited about the semester because obviously we don't have to preach to the choir here about the value of a longer term experience. Certainly when you really want to dig in to a topic like this and do some kind of practical work. Shelley Fisher's asking about the number of students. This is a small program. This is an elite program. I think we probably would cap it at 20 or so because of what Nadav talked about in terms of really tailoring the placements for the interests of the students. And a big year is 15 students. If we were to see that we were all of a sudden overwhelmed, and there had been students who were not appropriate, they didn't have the maturity potentially, I suppose, after they were vetted by their own universities. If we see that we're really overrun with students, then we'll talk to Nadav about more staff and more opportunities and how we can enlarge it. But it's a pretty small program for the right student. Okay, what else can we tell you, folks? Let me see what's coming up here. Actually, I wanted to give Nadav a minute to talk about you're developing a master's program and what that will mean for the track program in terms of the extra opportunities that it will offer to the undergrads. Because I think most of the people here, I don't know everybody who's online, but most of the people here are dealing with undergraduate students. So it's important to explain what that means when you're opening a graduate program in terms of undergrads.
Right. Can you hear me now?
Yes.
Okay, so we just got approved a master program in global health policy. And this would be open in not the coming year, but the year after 2015, 2016. And this will be probably a summer semester and then 2 other semester and another summer semester. It's pretty much a very straightforward courses like health economics, epidemiology, sociology of health. It's actually very similar to the program we have in Hebrew, but one, it will be in English, of course, the whole courses. Second, the main focus will be on global health. So we'll be dealing with developed countries and developing countries. And part of the students are going to be from our international MD program. So those are mostly from the US. But also we are going to have probably students from India and China. So it will be very, very diverse. We have a quite strong connection now with Drexel, University of Illinois, Chicago, Columbia, UCLA, but of course other universities are very, very welcome to have this connection. And again, a strong emphasis on doing practical work in the field, and a strong emphasis on health disparities issues. So this will be open not the coming year, the year after, but this July we are going to do a short summer course that for 1 month, and students from there can enroll the year later for the whole program.
Okay, thanks, Nadav. We have a number of graduate programs, and in English, and what that means is that if you have really advanced students, somebody in their junior year, maybe their senior year, or going into their senior year that wants to do a semester, and they're really far along, there will be graduate level classes for which they will, if they meet the prereqs, they'll be able to take as well. So it's a great opportunity for a student who really wants an international experience in global health to do it with us, which leads me to another question, which is why, I'll frame it for you, Nadav. These folks who are listening have partners all over the world who see opportunities all over the world. We see on a listserv every day some kind of program for global health. So why would they study global health at BGU? This is the commercial. Why this program? Why at our university? What's so special about it?
Okay, so that's the easiest question. One, we have an amazing faculty members that are doing anyway many teaching and research on global health. We have Ben-Gurion University, was presented also by Andy, that is located in a fascinating place that we have immigrants, we have Bedouin population. We are 1 hour on one side from Tel Aviv and just located also in the desert, dealing also with issues that Israel is cutting edge, such as vaccination policy, such as immigration absorption, both of immigrants and healthcare workers that are immigrants. The atmosphere at Ben-Gurion University is unbelievable, and also the opportunity to learn and then do the practicum in a way that I spent several years in the United States. I don't remember such a close proximity between the community and the university. Ben-Gurion University is well known for that in Israel, but also outside of Israel. Comparing to the Hebrew University, Tel Aviv University, I have very good colleagues there, but sometimes there is a kind of a disconnect. We are working with the community. We have one major hospital, the health district, a major sick fund, all working together, collaborating. The atmosphere is excellent. The students' life is excellent. And I can give you details of our students, and they're all coming back, returning and working with us. So I think this is really unique.
Mm-hmm. It's BGU, for those who have not had the chance to visit us, is so involved. We have a crazy statistic. It's something like 65% of BGU students do some sort of volunteer work in the community. I mean, I ask every time I go, and every time it seems like the statistic, I don't know if it's like urban legend, but there is actually a building on campus, a very large building that hosts all kinds of community organizations. Big Brother, Big Sister, Meals on Wheels, the Israeli versions of these sort of things. And that's how much they get foot traffic. That's how much the municipalities, they have offices on campus because there's so much interest from the students to be involved in the community that they make it that easy for them. You don't even have to go into the city. You can go right on campus and we'll set you up. This is the nature of the Israeli student who comes to BGU. They've already done 2 or 3 years of military service in most cases. And now they want to do more. And that's what makes the university so popular and so unique and so warm and so welcoming to the international students who are not off in their own little neighborhood or bubble, but they're living with Israelis of every stripe, by the way, right? They could be living with a Jewish kid from Tel Aviv or a Palestinian student or a Druze student. So, I like to give that commercial because I'm so proud of that it's so integrated and there's no manipulation in the roommates. Our people get X number of beds in the dorms and they get thrown in there. There's no making sure, that they're with the right student. It's absolutely natural, organic, and there's lots of little, peace process conversations going on in those dormitories. I mean, it's fascinating when I speak to the kids when they come back. So I think that the actual atmosphere of BGU is incredible anyway, but when you're talking about students that have the word global in their major or in what they're interested in, this is really a place to do it. And then you've got people like Nadav who could also teach anywhere. And that leads to another question, which is why are you so interested? Why do you give so much time to international students? Clearly you must be popular with the Israeli students, and I know that you teach them as well. But where did this interest in the international undergrads come from? And Nadav, we've been asked to ask you to please turn up the volume. People are having trouble hearing you. And that they get blasted when I speak, so I should be a little quieter. Sorry. It's hard for us to regulate it. We're having a technical issue.
My experience with undergraduate students until now is very exciting. People that arrive are usually very engaged. I see them also then as ambassadors about both Ben-Gurion University and Israel, especially, in this not so simple political situation. And I think that when they are here and see on the ground how Israelis and Palestinians, how Jewish and Arab are working together, I think then later they have a very different perspective on what's going on really in Israel and how health and public health can be a bridge actually to improve, the life of Israelis anywhere.
Okay, great. Thank you. You've had a couple of sabbaticals on this end of the world, right? Where were you? Where did you spend time in the States?
I still have a position at the Columbia School of Public Health. I was at University of Illinois, Chicago School of Public Health. Actually, when Obama was elected, I went to Grant Park, and this was quite a historical moment. Was on sabbatical also in Europe in Heidelberg University. Spent a semester also at UCLA School of Public Health. So I'm quite familiar with the American system, and during my PhD, I spent 3 years at Harvard Social Medicine. This was about 16, 17 years ago. And in general, I do believe in collaboration, as Andy said, and I think that we should have here people from abroad. They can diversify, our way of looking on issues, and it's an amazing experience. By the way, sometimes we have also Israeli students taking our class, and it's a good opportunity for the Israelis and the non-Israelis to meet and discuss issues together.
I have a bit of my commercial I want to make before we sign off, unless I see another couple of questions, which is that what's really another thing that's very unique about BGU is the accessibility, so that somebody like Nadav or Alon Tal or many other sort of superstar people in their disciplines are available to international undergraduate students. And one of my favorite anecdotes is that our president, Professor Dr. Rivka Karmi, is also a physician, and she was at one point the dean of our medical school. And about 3 years ago, we had 2 young women on the OSP in the global health track, I believe, who were pre-med. They must have been in the global health track. They were pre-med. And somebody had the idea that it would be really nice if they could have some time with Rivka. Rivka, by the way, not professor, not doctor, not president, Rivka. And did she have any time to maybe meet with them? They had some questions about medical school and women in medical school and all of that. So Rivka cleared her calendar. She said, of course I have time. And she brought these 2 young women in, and she brought in the coffee and the cakes and the food and the whatever. And she sat with them for 2 hours and talked about what her life was like being a medical student, in an era when it was, not so common for women. And the career path that she took and what it meant for her personal life and all of that. And it was really life-changing for these 2 kids. I don't think they would have had that sort of accessibility in their home university. And we're talking about a university with 20,000 students and 5 campuses. And they had 2 hours with the president. So it's really a unique place. I'm really so proud to represent it and so happy to work with people like Nadav. And we promised we would, keep it under an hour, and we will do that. And unless I see anything else coming in, this is your last chance. Diane, I hope I'm not blasting your ear now and that it's gotten a little better. Okay, so I think we'll probably end the formal presentation now. Many of you know how to contact us because you have the information you received in the announcement on the webinar. If you go to our website, you'll see lots more detailed information about BGU, about the Global Health Track, how you can get in touch with us. We are incredibly accessible and happy to answer individual questions. And that's something that also our partners always tell us, is that we're very user-friendly. We really value our students. We're the smallest of the programs in Israel, and that's something that gives us the ability to really give individualized attention to every student, academically and personally and socially. And it's really what we're proud of doing. We do it pretty well, we think. So Nadav, thank you for giving us your evening. Of course, he's 7 hours later in Israel. We need to let him go back to his family and his life. And actually, I've been asking, people are writing in and saying this was very interesting. So Nadav, thank you. Congratulations. It was very interesting. And someone has asked if we could share the presentation via email. There's a couple of things. We will post the webinar on our website, and shortly after we end here, within the next 24 hours, you will get an email that gives you the link. So you should be able to access this at any time. If you have any problem with that, you'll let us know and we'll make sure you get the slides. Okay? So thanks so much to everyone who gave up some time today to be with us. Please don't hesitate to be in touch with additional questions. If they're very detailed relating to the academics, I will make sure that Nadav gets the question to answer it. And if it's more logistical, I'm happy to help. Okay, it's very hard to say goodbye when I can't see any faces, but I'm seeing lots of nice, really nice notes that I can't acknowledge every single one of them. But thanks everybody for thanking us. And I'll see some of you out at NAPSA. If there are any students out there who are participating, please be in touch with us. We'd love to see you. We promise that it will not be an experience that you can get anywhere else. Okay, gang, I think we're going to end and look for the link in the coming days in your email. Happy Memorial Day weekend, everybody. Nadav, I'm signing off. Bye.
Thank you so much, Andy, and thanks for everybody.
Okay.
Hope to see you in Israel.
Yes. Bye-bye.